doctor.
I think it's such a myth that gets sold to all of us as mothers that pregnancy and motherhood is this great thing. We're all exhausted. We all feel like we're not doing a good enough job. We all feel guilty about it, but we're expected to pretend that everything is okay all the time and that it's absolutely perfect. And it's not. Baby blues are very, very common, but baby blues shouldn't last more than 2 weeks. In most women, say 90% of women, baby blues are going to last 48 to 72 hours and then they'll be gone. If your baby blues are lasting more than a week and definitely not more than 2 weeks, you need to seek help. The treatment that we decided on was a mixture of therapy and medication. I chose to do medication for 2 reasons. One, because I had a small baby and I wanted to get better, and medication definitely helps you get better quickly. And then I did therapy as well because I needed the support, and I felt that having the combination of both would help me get better quickly. And I must say they've both been a godsend, and definitely the therapy has helped me understand a lot of things. Everybody feels a bit scared. Everybody can feel nervous about things. And women can often feel that I don't want to think about postnatal depression. I don't want to even consider it because it's too scary to look at it. But the important thing to realize is that if you get help, and if you get help quickly, you can resolve it quickly, easily, without any lasting effects. The biggest message I would want to give to all mothers is there is nothing shameful about having postnatal depression. Women feel so guilty about it, and women feel that if I say I've had postnatal depression, it means I'm mad and I'm a bad mother. And that couldn't be further from the truth.
You're not bad and you're not mad. You can almost hear the sighs of relief reverberating throughout the country. And it's the same message that Brooke Shields famously shared in her book about her experience with postnatal depression, Down Came the Rain. Do you get tears aplenty in your practice, Azelle?
Yes, we frequently see patients with postnatal depression. However, I feel there's a lot of people out there who actually do not present to us. People who have the symptoms, but because there's still a stigma, people feel they're bad mothers. If they have to see a psychiatrist to help them, they don't present. And I think that's actually quite a big problem worldwide. That's
right, the taboo around postpartum depression. But there's a difference between baby blues and postpartum depression, isn't there?
Yes, there is. The baby blues is something that would usually last a few days, up to a week, maximum 2 weeks. And people would experience emotional lability, they'd be tearful, they'd struggle to sleep, be irritable. But it's something that would usually recover by itself and with some support. Where postnatal depression is a lot more serious, and it's a condition that actually needs proper treatment.
And it lasts a whole lot longer. I mean, you're looking at 6 months at least. What sort of signs and symptoms?
Well, people would feel extremely depressed. They would stop enjoying anything. Even bonding with their baby would be a problem. They wouldn't enjoy being a mother at all, and that would lead to feelings of guilt, which is a really important symptom of postnatal depression. They would become very irritable, unfortunately, towards their spouses most often, yes. They would stop sleeping. I know they don't sleep a lot anyway, but even if they have the time to sleep, it would be very hard for them to get to sleep. The eating pattern can change, very low energy levels. Anxiety is also quite an important symptom of postnatal depression. People often start having irrational fears. You know, they're scared that something will happen to the baby or happen to their partner, and they often want the partner to be at home all the time because they become very scared of being on their own.
Before we go any further down that road, let's talk about how we treat postnatal depression.
I think, again, we have to look at medication, firstly. That's something that's very important. That's something that can help you to get better quickly if you suffer from postnatal depression. Then there's the psychotherapy, which is also something that we see is very helpful. And then lastly, support, obviously from husbands, family, support groups, all those kind of things can also help to
quickly on medication. Any damage or danger to the baby? I mean, going through breast milk, being excreted through breast milk, can't it?
I think that's the biggest fear of mothers, and that's why they don't present, because they're scared that they'll be bad mothers if they take medication. We know that most antidepressants are excreted through the breast milk, but there's some of the antidepressants that's secreted in very low dosages, and we see that it's actually not been proven to be harmful to the baby. you always have to look at pros and cons.
Sure.
I mean, it's often more harmful to the baby to have a depressed mom than to have a mom on medication. She can be a good mother, she can enjoy the baby, but there's a tiny bit of medication in her breast milk. So.
I'm sure there are a number of young moms hanging on your lips at the moment, so give us some hope, Azelle.
I think the main message would be that suffering in silence is not the answer. For you to sit and suffer for months and months is not going to help you or your baby. It would definitely be best for both of you to get proper treatment.
Great. Azelle, thank you so much. Love those insights. And husbands, you too owe it to your wives to pick up on the signs and symptoms of postpartum depression and give her all the support she needs. It's going to make your life a whole lot easier too. Unless, of course, you enjoy having your head bitten off. Frank Rautenbach, who plays the lead role in the Bang Bang Club, may not be in line for postpartum depression, but he's got some great insights into good mood food from Andrea.
Cipla will make it better.